The two things that probably surprised me the most was the issue around obesity. Not only do we have slightly higher rates of obesity in Windsor-Essex, but the things that are associated with that. So we did see some high sedentary time. We saw, a lack of maybe diet quality or fruit and vegetable consumption. So likely leading to the higher rates of obesity. And then second of all, we saw a high rate of blood pressure, and likely linked to the higher rates of obesity, but that was quite surprising because we don't tend to think of blood pressure as a problem in children and adolescents, and that was one of the things that was unique to our study, in that most researchers don't include this measure because it's usually not a problem in kids, and we actually found that it was.
To date, the public health unit has been doing an excellent job with regard to health promotion. The resources that they've been using have been based on national data, and our findings will help them tailor some of the needs specific to the children in Windsor-Essex County. I think that because we have the multicultural population, and I think last I heard Windsor's the fourth most diverse city in Ontario, that we need to be very specific in our programming, and if we're going to be putting money into programming, we should be making sure that we're meeting the needs of the population that we're intending to serve. So hopefully when we get more specifics about the data as far as the nutrient quality and what the children are eating, and to try to identify some of the factors that are leading to the overweightness and the obesity that we're seeing, we can have some impact on program development.
The findings of this study further support what we already know and which we already want to advocate for, and that's healthy eating and increased physical activity in the schools. With the introduction of the new food and beverage policy that was mandated by the Ministry of Education and will be implemented in September of 2011, this further supports the need for that food and beverage policy, which looks at healthier choices in the schools for students, any of the food sold in the schools. And the health unit is there to support the schools and to further promote that message and make sure our students have healthy choices, and also link it with the need for increased physical activity.
And now that we have the local data, what we're really hoping is that we can tailor some health promotion strategies and programs to the data that we saw, or to the information that we obtained. Prior to this, we were basing all our strategies and campaigns on national data sets. So this will allow us to really target to our community.
The schools are very receptive to health unit programs and resources. The school nurses do develop a relationship with their principals, and most times it is the commitment of both the school nurse and the principal to move the issue forward in their school and be as involved as they can. It does take commitment to move physical activity and healthy eating in your school to make it a priority. And together, and with the school community, the parents and the students, involving and engaging everyone at all levels is really what is needed. So the health unit's there to help. The school nurses are very willing and receptive, and we go by the lead of the school.
So some of the things that we need to be doing that we're not doing include, moving more, getting more active, incorporating daily physical activity into sort of everything that we do. Active transportation has been a key message the last little while with the health unit, and we did see some really good things with that. So maybe children, adolescents can encourage their parents or their families to go for bike rides. We also need to start watching what we put in our mouth and start to be concerned with what it is, and take a look at the ingredients, take a look at the food label.
The Ministry of Health Promotion has really gone to the stream of youth engagement, and a lot of the focus on adopting healthy behaviors has been this youth engagement model, where you talk to the students and you talk to the youth and implement initiatives that they feel will be useful and helpful. And we have done that. The snack committees I referred to, this Student Nourishment Action Group, it does recommend that you have student representation on there. We recently were involved in a pilot project, after-school project with Herman High School, where it was a cooking class. It was called You're the Chef, and our nutritionist and a school nurse went out and they helped facilitate this group, and it was teaching the students, working directly with the students, and preparing food in a healthy manner. And we've also provided shopping market tours to students of alternative schools where they're actually shopping for themselves and trying to make informed decisions. There are lots of curriculum supports that we want to work on as well and provide to the schools at different grade levels. For instance, in the grade 5 curriculum for healthy eating, they talk about food labeling, and it is critical with the new food and beverage policy to read labels and know what's high in fat, high in sodium, high in sugar, and make choices that are healthier for the students. So there are activities and there's ways to engage students, but it definitely has to occur. And hopefully we can support the parents as well, and the two will come together and come to the decision that together we're going to be healthy.